Aloha everyone, my name is Joni Redicant and you are watching Joni's Show. Did you know that I have the best doctor in the house? Well, let's get to know him. I have Dr. Farzad Pourarian. Did I say that right?
Oh, yes.
Yes, a very fascinating doctor. Oh my gosh, I can't wait for you to get to know him as well. So how are you today, Dr. Farzad?
I'm very well, and thank you for having me.
Oh, of course, it's my honor. And so let's get to know you a little bit more. Tell our viewers where you came from, who you are, because you're not local.
Right, right. Yeah.
Yes.
So I'm a sports medicine and internal medicine physician. I just started at Infinity Life Center. I'm born and raised in Pittsburgh, Pennsylvania.
Okay.
I really enjoy it here. Everyone's been very kind, and it's a great new way of life and culture that I'm getting used to, and I enjoy very much.
Very nice. So what brought you to Hawaii?
Well, when I was finished with my fellowship, I went through the interview process of certain places, different places. I put my resume on a website and on a sports medicine website, and a very kind gentleman, Dr. Michael Pasquale, found my resume, was impressed, invited me to come interview to Hawaii to work at the Infinity Life Center, and it just clicked. You know,
Just like that.
Just like that, we hit it off, and next thing you know, we made a great treatment process together that we're going to, work together and promote wellness, and here I am.
Yes, a very fascinating story. Have you been to Hawaii before?
I went to Maui once for vacation, but I'd never been to Oahu, and this is my first.
How long ago was that in Maui?
That was about 15 years ago.
Yeah, so you're only like 5, 10.
No, I won't say how old. No.
Yeah, very young, doctor, looking young. Yeah, so I met Dr. Farzad when we have our FAMES Business and Leadership Workshop. So this was a few months ago. And I thought that was, it was very intriguing for you to be there. How did you like it so far?
Oh, I enjoyed it. It was one of my first
networking
experiences for networking and things like that, and it was an excellent symposium.
Oh, thank you.
Yeah.
Thank you. I'm so glad that you're able to come and attend, and that's what FAMES is all about, that we provide those free business and leadership workshop. And yeah, I'm so glad you're able to come there.
It was an excellent experience, and I thank you for inviting me in the first place.
And I think you just arrived prior to that.
Yeah, I was brand new, about a couple weeks in.
Yeah, because I was wondering, it's like, this doctor is coming to attend our workshop. Sometimes that doesn't happen.
Yeah. I just wanted to get to know people and.
Open-minded. I like that. So, okay. So you've been in school or you were in school for like 15 years with different specialty from D.O, medical education, and a regular doctor. But again, what fascinates me when I was reading your bio is just like, wow, very, very impressive, because it's kind of like you're doing things out of the box in a holistic approach, like you had mentioned in there. So what do you mean, Dr. Farzad, holistic approach?
Well, in the osteopathic holistic approach, we look at the body as a unit, and the body is supposed to heal itself. Well, you generally don't want to add any more toxins or any medications that are unnecessary to the body that only mask pain. We want the body to heal itself, and we use a hands-on approach, as well as we can. I also utilize a lot of regenerative biomedicine injections that include stem cell, platelet-rich plasma, PRP, and Prolo, and these are just natural ways of healing the body.
Right. Yeah, so when you said stem cell too, I've been hearing a lot of stem cell, that there's a way of taking out from your body and reserve it or something like that. When you do, it's kind of like you're putting in the bank your own stem cell, and when you need it. But although, is that like a painful process, or?
It depends. There's multiple ways to obtain stem cells from the body. Sometimes people use their bone marrow. We utilize our fat tissue. So our process is essentially painless. You don't feel anything except maybe a little bit of pressure. And
you promise?
Yeah, I promise. I promise. I'll sit there with you. Because the initial process, we obtain a little bit of fat cells from your body, and that can leave a minor bruising or just a little bit of soreness for a couple days, but that's all the pain you'll feel. And
I heard too that you can use that to keep you look younger.
Yes, yes.
Wow, I need that.
So yes, at the Infinity Life Center, we have we promote wellness through many ways. I take care of the musculoskeletal and general medical conditions. My colleague Michael Pasquale does the cosmetic, and we can inject stem cells in the face or anywhere that is needed.
Wow. That's, like I said, it's kind of like out of the box, different ways. But I really like when you were saying that, or when we discussed about having the natural way of healing yourself. Is that, I mean, there's so many medications, and actually, there was a study before, or a research, that a lot of people are dying more because of the medications. It's doing more harm than good, the synthetic that goes into your body. So, okay, what's some tips to our viewers, Dr. Farzad, to be able to prevent, how can we prevent taking those medications? And also like injuries, you mentioned as well, that we can prevent injury as well. So, okay, that's a lot of questions for you.
That's okay, yeah, no, but the main focus is that I don't want to prescribe narcotics or any medication that masks the pain and doesn't treat the actual cause of the problem. That's the number one thing. In regards to injury prevention, there are different modalities we use. For example, one is a biodex machine, where I can have you stand on this machine and I can see on your legs which muscle is weak. Is it your quad? Is it your hamstring? Is it your calf? And I can see if there's an imbalance on one side to the other. If your left side is weaker than your right, the muscles, then you're more prone for an ACL tear or some sort of ligament tear in your knee. So based on your measurements and your imbalances, we can prevent injury from it ever happening in the first place.
So when you see that there's some imbalance, then what kind of treatment do you do, or what advice then?
We always start with conservative measures. We'll strengthen those muscles, whether it's through physical therapy or specific core exercises that I will teach the patient. But overall, we just we see what spot is weak, and we get it before it causes any more damage.
That's very interesting, because yes, there's a lot of doctors that when a patient would go in and they say, okay, I have this pain, they prescribe narcotic medications, then they have side effects, then they prescribe more medications. I have a friend who works at the pharmacy, and she said, Joni, I feel so bad sometimes dispensing those medications, because a lot of the elderly people, they take from 5 to 20 medications a day. And so how is that looking inside?
You know, they can all mix together. You know, there's a lot of complications that occur when one person even just takes 2 medications. Some of these medications are necessary, you know, blood pressure, things like that. We understand. However, whenever you're getting overdiagnosed or over-treated.
How do we know if we're over-treated?
You know, it's tough, because each doctor will say their own thing. They give their own opinion.
So how do we know with the right doctor, proper doctor?
Exactly. So you do want to stick to your specialists generally, if you really are questioning a physician or anything like that. But in general, it's tough you're going to have your primary care physician, then you're going to have all your specialists, and they all could be saying different things, so it's very tough on the patient. So you really, the most important thing is when the patient leaves, that they have a good understanding of what's going on, because one little mistake here and there through communication can cause a lot of problem.
It caused them a lot of problem and a lot of money. But there's some that they go for a second opinion, another second opinion. I heard that too, like someone went to like 5 different doctors and different answers, different advice. So again, as a patient, it's like, okay, who are these doctors? Who to believe? It's hard to believe.
It is.
But like what you mentioned earlier, though, that our own body, we can heal our own body by eating the right food, or just thinking positive?
It's a multifactorial, you know, it's never just one thing. You have to incorporate exercise, diet, but you know, some people exercise a little too much. You know, they'll overdo it. They'll run 100 miles a week and wear out their knees and things like that. So everything with a balance.
Right. Yeah. So yes, if you have, well, it's nice to have like a trainer, I guess,
Yeah.
fitness trainer, because again, I mean, I met a lot of people too that when they overdo, like you said, then they might, you know, they have shoulder pain, back pain, then they're in bed for like maybe 2 months, and then now it's hard for them to get started. But it is make a difference when you kind of like balance things out and don't overdo things. So get great advice. So and it's very fascinating too, because I mean, you look like you're only 20, 25 years old, but to have been in different specialty here, it does require a lot of many years to be in the medical school. But what inspired you, Dr. Farzad, to be a doctor?
Well, I started volunteering at a hospital at a very young age, and I was roughly 12 years old, and they weren't allowing kids that young to start. But my mother gave a good word for me. She also worked at the hospital. That was a huge influence for me. She was not a physician, but she influenced me to do hospital work, and I loved it. Just the patient encounter, just the feeling you get whenever you've helped someone. And as a volunteer, I'm not doing much. I'm bringing a blanket. I'm doing very little, you know, I'm not saving lives the same way as I feel now. But just getting that feeling, that satisfaction was really worth it, and it guided my way of
That's when you did volunteer at the emergency room.
Yes, yes. I was.
Weren't you scared?
Yeah. Well, you know,
No?
there was the first time where I'd seen life-altering or very fatal situations where it was kind of a wake-up call. I was like, wow, am I ready for the medical field? You know,
Right.
this guy
Yeah, 12 years old?
Yeah, I had to be a little older to go in the ER.
I
but
see.
still,
Okay.
just a couple years. I was still very young, and it was
Yeah, it's a little
an
bit
excellent
scary, I think.
experience. Yeah, but it kind of weeded some of the people out that weren't ready for the blood and guts.
Right. Well, as I mentioned earlier, that when I was working in a dietitian department, and I was passing the emergency room, and I kept telling myself, there is no way I'm going to work in there. I'm scared with blood. I don't want to see the sight of the blood. I will faint. But wouldn't you know, that's where I did my intern at the same hospital.
Nice.
And that's where I had my first job. And my first night, actually, like talking about blood, and we have a patient, or a couple, they're young, in their mid-20s, car accident. And I mean, they were full of blood. And then after that, I have this, it was a Samoan patient that she had a heart attack. So, and then another car accident, this gentleman, and he was just, I mean, he unfortunately, he passed away there. And they said, Joni, okay, it's time to clean him up. And it's like, oh my God. And it's like, what do I do? But when you are busy in the emergency room, it's just like you forget everything. You just focus on the patient.
Yeah, you don't even think about it.
Right. But when I go home, it's like,
wow, did I just do that? Yeah.
Right, exactly. But yeah, so when you were going through the intern and everything, what was the most challenging part in your career? Or as an intern?
I'll give two examples. One is the studying part of medical school. The amount of information and the ability to apply it clinically is it was taxing. You know, it's definitely doable, but it was one of the obstacles in my life where I had to go deep inside of me and like find the strength. On top of that, then there was in the clinical aspect. It was probably the first time I told a patient they had cancer. I was a medical student, and it was just she started breaking down in front of me, crying right away, and
what do you do?
And I had to just, I want to show the proper empathy, or this, I don't want to show that I feel sorry for her, but I do have to show that I am sorry for her. Right. It's a very interesting way of
comforting.
Comforting, interacting, and you have to be warm and kind and. It's just
try to find the right word to comfort that patient. Yes. It is really hard when somebody find out that, oh my gosh, now what? How long am I going to live? Do I have 6 months, a year? And as a doctor, it's like, how can I, tell this person? Or you're gonna live forever, but we don't know. But that it's really, I'm sure it's been very difficult in your part to give the bad news, or speaking of that too, so how is it like when you tell a patient that this is what you have?
Right, it's exactly it. But they have to feel a warmth from you, that you care, that you're not just reporting information.
Right.
You know, and then you got to have that relationship with the patient, and that's the most important thing. They have to know that you're on their side, that you're not part of the, you know, the other guys. Because sometimes you have to give bad news. You know, in regard from my work right now, you know, I'll tell a runner that they shouldn't run as much anymore.
Yes.
Oh man,
it might be devastating.
That's the end of the world. Yeah, they won't come back to you.
Oh.
You know, but so you have to find a way to meet in the middle, where you tell them, yes, you can run, but we gotta kind of switch it up. We got to cross train. We got to do a little elliptical or some aquatics, just so you're on their side. You know, we want to get better together. It's a team effort. I meet my patients halfway. They do some things on their own. I do everything else.
Yeah, because they cannot be expecting miracle that you know the injured, or they want something, a magical word or something, magical pill, magic pill.
Some
that
do.
Okay, go, unfortunately.
It's okay. That's human nature.
Exactly. So it is. You had to deal with a lot of different personality, and to deal with that, I'm sure it's very difficult sometimes to deal with it, unfortunately. But that's how it is. Like you said, it's human nature, but as long as you understand as a doctor, yes, you have to be more understanding and be more empathetic and be more comforting to these patients. Although there's some doctors that, okay, here's the medications. And sometimes just like they don't care. They want you to just be out, and next, who's the next patient?
Right.
Yeah,
and some physicians, they kind of just look down and write while they're not looking at you. They don't show you that. I would like to, you know, my medical school definitely enforce that upon us, to make sure that we're very cordial with the patient and show them. Right.
Yeah, because a patient already, you don't feel good as it is, and then if a doctor is just like showing you the same care, it's like, then we don't want to come and see you, right?
Right.
Yes.
Exactly. Right.
But I see that. I think you're very you're comforting, and like you said, you have to meet you know, in the middle, because you can advise the patient, but if they don't do what they're supposed to do, then it can be frustrating for you as well. So, okay, so besides treating patients, making them feel better, what do you do? What have you done exciting here in Hawaii? Surfing?
I haven't gone so far to surf yet, but I definitely enjoy the beach. My goodness, I try and go there as much as I can.
Okay.
I am also a golfer. I haven't really been able to get out yet to play too many different courses, but I like that. And then I've tried a couple hiking areas. I would definitely do more hiking. I'm just got to get in better shape.
Oh, you look good already. Have you gone to Diamond Head?
I went to Diamond Head once.
Oh, how did you like that?
It was very nice, beautiful. All of them are so beautiful. You know, just you can't beat the scenery. It's paradise here.
Right, you know? Exactly. So, are you going to be here for good?
I want to be, certainly. That's the goal. You know.
Okay. So
the answer to that is yes. However, you never know in life, right? Yeah.
Of course, of course.
But the goal is to most certainly. Start
to be here. Well, I think I mean, I came to your office. It's beautiful. So how with the ocean view and everything, right?